Welcome to Providing Perineal Care for Individuals with Intellectual and Developmental Disabilities. Developed and presented by the Office of Community Quality Improvement, in collaboration with the Office of Integrated Health Supports Network at the Virginia Department of Behavioral Health and Developmental Services. The learning objectives for this training are: 1. Identify the perineal area of the body. 2. State how often perineal care should be performed. 3. Identify signs of skin breakdown or infection in the perineal area when completing perineal care. 4. Outline proper steps when preparing to perform perineal care for male and female individuals. 5. Demonstrate proper technique for assisting individuals with perineal care. 6. Report and accurately document any observed signs of skin breakdown or infection in the perineal area. And 7. State why performing proper perineal care is important to prevent infection and skin breakdown. The perineal area. In healthcare, the perineal area is sometimes referred to as the perineum or perineal area. The perineal area is the region of the body between the genitals, the vaginal opening for females, and the scrotum for males, and the anus. The perineal area consists of several layers of skin, the pelvic bone, and muscles of the pelvic floor. The pelvic floor muscles hold the bladder, the colon, and the reproductive organs in place in the body. The female perineal area is about 1.5 inches in length, and the male perineal area is about 2 inches. Perineal care should be done for an individual with developmental disabilities who cannot perform their own activities of daily living, such as bathing, dressing, toileting, or eating. It should also be offered to any individual who might need additional toileting assistance from their caregivers. Perineal care should be done as soon as possible after each episode of bowel or bladder incontinence. Stool, feces, and urine begin to break down skin tissue on contact. An individual left sitting in feces has a higher occurrence of UTI. Incontinent individuals should be checked every 2 hours and changed as needed. Providing perineal care after each incontinent episode will reduce the risk of an individual developing a urinary tract infection and will decrease the risk of skin breakdown. Getting prepared to perform perineal care. First, wash your hands. Next, gather equipment, which includes 2 clean bed protectors, 4 washcloths or wipes, a towel, a couple pairs of gloves, and a basin with warm water and soap. After you have your supplies, provide the individual with privacy by closing the door and pulling the curtains. Practice good body mechanics by adjusting the bed to waist height if possible. Ensure water temperature in basin is not too hot or too cold. Then put on your gloves. Next, talk with the individual and ask them if it's okay for you to perform perineal care. Position the individual on their back. Help them to bend their knees slightly or position them with bent knees to perform perineal care. Initially, when cleaning feces from the perineal area, the use of disposable wipes is suggested. Remember, always wipe from the front to the back. Remove any soiled bed protectors from under the individual by turning them away from you. Roll the soiled bed protector up toward the individual's back. Then roll the individual back toward you and pull the soiled bed protector out from behind them. Place a fresh clean bed protector under the individual's buttocks and repeat the steps above. The 2 types of perineal care we will be reviewing are male and female. We'll start with reviewing female perineal care. Begin by washing the area between the vaginal opening and rectum, also referred to as the perineum, with soap and water from front to back. Use a different part of the washcloth or wipe for each stroke. First, wipe the center of the perineum, then down each side. Next, spread the folds of the labia. which is the skin that protects the vaginal opening and urinary meatus. Always remember to wipe from front to back on each side. Rinse the area with clean water, the same way it was washed. Dry the entire perineal area, moving from front to back, using a blotting motion with a towel. Reposition the individual on their side to clean the buttocks. Wash, rinse, and dry buttocks and anal area, using the same technique used for the perineum. Make every effort to cleanse the anal area without contaminating the perineal area. Now we'll review male perineal care. If the individual is uncircumcised, retract the foreskin by gently pushing the foreskin towards the base of the penis. Hold the penis by the shaft. Wash in a circular motion from the tip down to the base. Use a clean area of the washcloth or wipe for each stroke. Rinse the penis with clean water. If individual is uncircumcised, gently return foreskin to its normal position. Then wash the scrotum and groin. The groin is the area from the pubis to the upper thighs. Rinse and pat dry the area with a blotting motion using the towel. Reposition the individual on their side to clean the anal area. Wash, rinse, and dry buttocks. Attempt to cleanse the anal area without contaminating the perineal area. Report and accurately document any observed signs of infection or skin breakdown in the perineal area. Always report cloudy, dark, or foul-smelling urine, which might contain blood, pus, or mucus. When an individual complains of burning or discomfort during urination. If an individual is urinating frequently, in small amounts. If an individual is showing increased agitation during perineal care. Also report when an individual is touching or grabbing at their perineal area more than usual. Always follow agency policy on documentation, which should include the time of day or night perineal care was completed. Each time perineal care was done within a 24-hour window. How the individual responded to the care performed, such as the individual was cooperative, or the individual was very agitated and crying out during perineal care, etc. Document the physical appearance of the skin in the perineal area, such as skin intact, skin had its normal color, no signs of skin breakdown, or skin was red and irritated, etc. And the features of the incontinence brief, such as heavily soaked with urine, or large amount of soft bowel movement, etc. The importance of perineal care is to wipe the perineum from front to back, moving bacteria away from the urethra before it can enter the body. Perineal care is important in reducing infections because the longer a dependent individual sits in feces, bacteria has an increased chance of entering their urinary tract system to cause infection. Because the longer an individual's skin is exposed to urine or stool, the greater chance of skin breakdown. Washing, rinsing, and drying the perineal area immediately after each incontinence episode reduces the risk of urinary tract infection and skin breakdown. Thank you for listening. If you still have questions about perineal care, contact a registered nurse, care consultant by emailing communitynursing@dbhds.virginia.gov.